On the continent now, many African countries are struggling to provide necessary healthcare services to their citizens. That's according to a new State of Universal Health Coverage in Africa report. Let's chat more about this now with one of those who commissioned this report. That's Malawi Health Department Director Gerald Manthalu. Dr. Manthalu, a very good morning. Thanks so much for your time this morning. Now, this isn't really news to us, is it, that the lack of proper healthcare on the continent? But what we'd like to hear more about is what African leaders actually plan to do. Because we do understand, in addition to your report, just sort of assessing the state of general healthcare in Africa, you've also found that African leaders are now sort of have more will to actually change this. So what's being done?
Thank you very much. Indeed, the report finds out that there is greater will by African leaders to move towards making sure that their citizens are able to get quality healthcare when they need it without facing undue hardship. And there are obviously steps that need to be taken. Some are being taken, but some that need to be taken. There's a realization, of course, that has been quite brought to the fore by the COVID-19 pandemic that our African health systems are really weak. You look at, for example, many African countries struggle to get PPEs, although they had resources to get them, but they struggled because we don't have strong manufacturing for health commodities in Africa. So although there is that political will, there are certain steps that need to be taken jointly as African health leaders to make sure that, for example, Africa is self-reliant in that regard. Yeah. There is also realization that there is a general trend of urbanization which isn't well planned, and because of that, we are seeing a lot of urban poor in the city, but who are not being properly reached by good quality healthcare. So there is a drive now, or it's already happening, but there is increased momentum to make sure that we strengthen primary healthcare, especially for the urban poor due to urbanization.
Well, what is the plan, Dr. Manthalu, though? If you can give us some idea of your recommendations, also in light, you mentioned COVID-19. We can't talk about this without talking about COVID. And you said what it has shown at. It has shown up the sort of lack of action, the lack of healthcare. It has shown it up. But how has it also changed our game plan as to how we can fix this?
Yeah, so in terms of I think that there is realization, for example, that we need to build strategic capacity for disease surveillance across Africa. Not every country can do this at the same time, but for example, if we have got clusters of capacity to conduct disease surveillance robustly, that would be critical for Africa. There is the issue of manufacturing, for example. There is the issue of developing our research capacity so that we don't only rely on vaccines from other continents, but we develop our own vaccines as Africa. There is also the issue about making sure that we address negative norms. You know, there is also the issue of vaccine hesitance at the moment. So jointly as Africa, make sure that we deal with that, dealing with the issues of weak governance in the health sector, the issues of corruption and poor governance almost everywhere in Africa. So the report is making concrete recommendations on how we can tackle that. And there is also realization that the fundamental thing that we need to do is to make sure that there is a mindset change. Because when you look at the way healthcare delivery has developed, there is legacies of colonialism, which have really carried forward and have undermined, for example, decentralized healthcare delivery. There's also neo-colonial influences where we have seen big, powerful institutions have affected the way we deliver healthcare. So it's also really changing the mindset of us Africans in the way we just promoting self-reliance and the mindset that we can do it, and breaking from the sort of colonial thinking that has really shackled us to do things in a certain way.
Dr. Manthalu, if I can ask you very, very quickly, I mean, South Africa has always been seen as the kind of leader on the continent that, everyone else takes their cue from us. We are the gateway to better things happening on the continent, but you are aware of the criticism of how we've handled the pandemic, how we've handled our vaccination situation. Have we lost our place as that leader or that strong point on the continent? Very quickly for us, if you can, please.
I don't think South Africa has lost this place. It's still a leader in this regard, and most the conversation still places South Africa as one of the strategic countries that's going to lead developments in so many developments that are going to spill over to other countries. So that was, I think that's regarded as an instance that just happened, but South Africa is still being regarded as a leader in so many aspects. For example, health research, health financing reform, for example. So South Africa is still in that place.
All right, well, that's good to hear. Let's hope we can continue to help the rest of the continent reach those goals that you mentioned. That's Dr. Gerald Manthalu. He's from the Malawi Ministry of Health, chatting to us from Lilongwe.